Tonight you are going to climb into your bed, settle into the same position you have slept in for the last 30, 40, maybe 50 years, and believe you are resting. But you will not be resting. You will be compressing your brain's waste drainage system. You will be straining your heart. You will be backing up acid into your esophagus. You will be cutting off lymphatic circulation, and you will wake up tomorrow morning and blame your age for how you feel, not your age. Your sleep position. A study published in the Journal of Neuroscience found that the position you sleep in directly determines how efficiently your brain clears toxic waste proteins overnight, the same toxic proteins that accumulate in the brains of Alzheimer's patients. And the wrong sleep position reduces that clearance by up to 25%. Every single night, 25% less brain waste clearance. Every night. For years. For decades. And that is just the brain. The wrong sleep position is simultaneously compressing your liver, forcing your heart to work harder, worsening sleep apnea, creating inflammatory pressure points in your hips and shoulders, and flooding your esophagus with acid while you believe you are healing. Over 60, none of this is trivial. Over 60, the body's ability to compensate for these structural stresses diminishes. What your body could absorb and recover from in your 30s, it is no longer absorbing silently. It is showing up as chronic back pain, as morning fatigue that coffee cannot fix, as acid reflux that wakes you at 3 a.m., as shoulders that ache before you even get out of bed. Stay with me until the very end of this video, because I am going to tell you the right side to sleep on, the wrong side to sleep on, and exactly why. I am going to give you a specific positional protocol and the pillow strategy that makes it work. And I am going to go through the 10 most important things you need to know about sleep position after 60 that no one ever told you. I am Dr. Michael Carter, a physician specialized in senior health with over 15 years of dedicated clinical experience working with adults over 60. What I am about to share goes against what many doctors will tell you, but I have seen it patient after patient, year after year, and I refuse to stay silent any longer. If you have ever woken up wondering why you feel worse than when you went to bed, please hit the like button right now, because this video is going to answer that question, and the answer is going to surprise you. Let me walk you through the biology of what happens to your body during sleep depending on the position you are in, because sleep is not a passive state. Your body is performing critical maintenance operations every single night, and whether those operations succeed or fail depends in large part on your position. Let us start with the brain. Your brain has a waste disposal system called the glymphatic system. The word glymphatic combines glial cells, the support cells of the brain, and lymphatic, referring to the body's waste drainage network. The glymphatic system essentially uses cerebrospinal fluid to flush the spaces between brain cells, washing out metabolic waste products that accumulate during the day. The most significant of these waste products is beta-amyloid protein. Beta-amyloid is the same compound that forms the plaques found in the brains of Alzheimer's disease patients. It is a natural byproduct of neural activity. Your brain produces it every day. And every night, the glymphatic system is supposed to wash it out before it can accumulate. The landmark study published in the Journal of Neuroscience that I mentioned at the beginning of this video found that glymphatic clearance was most efficient when subjects slept on their left side or right side as compared to sleeping on their back or stomach. And between left side sleeping produced the most efficient glymphatic flow based on the anatomy of the cerebrospinal fluid drainage pathways. But here is the detail that elevates this from interesting to urgent. The researchers found that chronic back sleeping reduced glymphatic clearance efficiency by up to 25% compared to lateral, meaning side sleeping. 25% every night. And when you calculate what that means over months and years in an adult over 60, whose glymphatic system is already naturally less efficient than it was at 40, the cumulative deficit in brain waste clearance becomes deeply significant. Now let us move to the heart. Your heart sits slightly left of center in your chest. When you sleep on your right side, gravity shifts the heart slightly toward the right, which some research suggests can create mild positional pressure on the pericardium, the protective sac surrounding the heart. In adults with any degree of cardiac enlargement, which is common after 60 due to long-standing blood pressure issues, this positional shift can increase the heart's workload slightly. Conversely, sleeping on the left side positions the heart in its most anatomically natural resting orientation. The aorta, the largest artery in the body, exits the heart and curves to the left. Left side sleeping allows the heart to pump into the natural curvature of the aorta with less resistance. Research published in the European Heart Journal found that patients with chronic heart failure had measurably better cardiac output measurements when sleeping on their right side compared to their left, which seems counterintuitive until you understand that in advanced heart failure, pressure dynamics change significantly. For adults over 60 without advanced heart failure, left side sleeping is the optimal cardiac position. And the digestive system. Your stomach sits on the left side of your abdomen. The gastroesophageal junction, the connection between your esophagus and your stomach, is also positioned such that left side sleeping keeps the junction above the level of stomach acid. Right side sleeping, by contrast, lowers the gastroesophageal junction relative to the acid pool in the stomach, making it far easier for acid to flow backward into the esophagus. A study published in the American Journal of Gastroenterology directly compared acid reflux events during left versus right side sleeping using esophageal pH monitoring. Right side sleepers had significantly more reflux events and significantly longer acid exposure time in the esophagus compared to left side sleepers. The difference was not marginal, it was clinically significant. And the acid that enters your esophagus during right side sleeping is not merely uncomfortable. Research published in the journal Gut found that chronic nocturnal acid exposure is one of the strongest modifiable risk factors for Barrett's esophagus, a precancerous change in the esophageal lining that is far more common in adults over 60. The lymphatic system is the fourth mechanism. Your thoracic duct, the body's main lymphatic drainage vessel, runs along the left side of the spine and drains into the left subclavian vein. Left side sleeping facilitates gravity-assisted drainage through the thoracic duct. Right side sleeping works against this drainage. Inefficient lymphatic drainage is associated with increased inflammatory burden, immune sluggishness, and fluid retention, and finally, the brain and spinal pressure. The glymphatic system we discussed is not the only issue with back sleeping. Back sleeping allows the tongue and soft palate to fall backward under gravity, which narrows and in some cases closes the upper airway. This is the primary mechanism of obstructive sleep apnea, and sleep apnea affects an estimated 39% of adults over 65. In the majority of those cases, positional changes alone can reduce the frequency and severity of apneic events by 30 to 50%. This is not small. This is the difference between waking 8 times a night from partial airway obstruction and sleeping through the night. The difference between restorative sleep and chronically fragmented sleep that accelerates cognitive decline, cardiovascular disease, and metabolic dysfunction. I want to ask you a direct question right now. Type your answer in the comments. What position do you currently sleep in most of the night? Back, right side, left side, or stomach? Just type it. I am going to read every answer, and I want to understand who is watching this video. Now let us go through the 10 most important things you need to know about sleep position after 60, counting down from least critical to most critical. And I promise you, number 1 is going to make you rethink everything about your relationship with your bed. Number 10, stomach sleeping is the most damaging sleep position, and it is damaging your cervical spine every single night. If you are a stomach sleeper, you already know your neck hurts in the morning. You probably assumed this was your mattress or your pillow, or just getting older. It is your position. When you sleep on your stomach, your neck must rotate 60 to 90 degrees to one side to allow you to breathe. This rotation is maintained for hours. The cervical vertebrae and the muscles of the posterior neck are held in a sustained asymmetric rotation that compresses the facet joints on the rotated side, stretches the muscles and ligaments on the opposite side, and places the cervical discs in a position of maximum vulnerability to the compressive forces of the head's weight. Your head weighs approximately 11 pounds. When your neck is rotated 60 to 90 degrees, the effective force on the cervical discs is significantly amplified by the angle. Research published in the journal Spine found that stomach sleeping increased cervical disc compression forces by up to 40% compared to neutral spine sleeping positions. 40%. For 7 to 8 hours per night. And for adults over 60 whose cervical discs have already experienced decades of normal wear, whose disc hydration is naturally reduced, whose facet joints are more susceptible to arthritic change, 40% additional compressive force for 7 hours every night is a progressive structural injury being delivered while you sleep. The immediate action. If you are a long-term stomach sleeper, you cannot simply decide tonight to sleep on your side. Your body has neuromuscular patterns that will return you to your habitual position within minutes of falling asleep. I will give you the specific transition protocol in the action plan section of this video. Number 9. The wrong pillow height is more damaging than the wrong sleep position, and 90% of adults over 60 are using the wrong pillow. Pillow height, what sleep researchers call loft, determines the angle of your cervical spine during sleep. For side sleepers, the correct pillow height fills the space between your head and the mattress, which equals the distance from the side of your head to the tip of your shoulder. This keeps your cervical spine in a perfectly neutral horizontal alignment. Most adults over 60 use a pillow that is either too thin because they have compressed their old pillow over years of use, or too thick because they prefer the feeling of a high pillow, or because they use two pillows stacked together for what feels like comfort. Research from the Journal of Physical Therapy Science found that incorrect pillow height in side sleepers created lateral cervical flexion of 8 to 15 degrees, sustained for the full sleep duration. This sustained lateral flexion was directly associated with morning neck stiffness, cervicogenic headaches, and progressive cervical disc compression that measured equivalently on MRI to the effects of poor workplace ergonomics, sustained for 6 hours per day. 8 to 15 degrees of sustained cervical flexion for 7 to 8 hours every night. From the wrong pillow height. The specific recommendation: as a side sleeper, your pillow height should equal the distance from your neck to your shoulder, measured with a ruler. For most adults over 60, this is between 4 and 6 inches. If you cannot find a commercially available pillow in this exact range, a memory foam pillow that contours specifically to cervical side sleeping geometry is the most reliable solution. Number 8. Back sleeping and sleep apnea are far more connected than most adults over 60 realize, and the connection is destroying their cardiovascular and cognitive health. When you sleep on your back, gravity pulls the tongue, the soft palate, and the uvula posteriorly. In adults over 60 whose upper airway musculature has naturally weakened compared to younger decades, even partial obstruction from this gravitational collapse can produce apneic events that interrupt breathing for 10 to 30 seconds at a time. Sleep apnea affects approximately 39% of adults over 65, according to data from the National Sleep Foundation. Of those, research suggests that roughly 56% have positional sleep apnea, meaning their apnea events are significantly more frequent and severe in the supine, that is, the back sleeping position compared to the lateral position. A study published in Sleep Medicine found that adults with positional sleep apnea who were transitioned to exclusive lateral sleeping experienced a 54% reduction in their apnea-hypopnea index, the clinical measure of sleep apnea severity. 54% reduction without a CPAP machine, without medication, without any intervention except position change, and the downstream consequences of untreated or partially treated sleep apnea in adults over 60 are severe. Each apneic event produces a micro-awakening, a brief arousal from deep sleep that fragments the sleep architecture. Fragmented sleep reduces deep sleep duration, the stage during which the glymphatic system performs its brain-cleaning operations. It elevates nighttime cortisol. It drives blood pressure spikes. Research from the journal Sleep found that adults over 65 with untreated sleep apnea had a 2.5 times higher risk of developing dementia within 5 years compared to those without sleep apnea. 2.5 times from interrupted breathing that a position change can reduce by 54%. Number 7. Shoulder pain, hip pain, and morning stiffness in adults over 60 are in the majority of cases a direct consequence of sleep position pressure points, not the arthritis your doctor blamed. I want to be direct here because I have seen this misattributed hundreds of times. When you lie on your side on a mattress that does not adequately conform to your body's curves, 2 points bear the vast majority of your weight: the shoulder and the hip. Inside, sleeping without proper mattress support, The shoulder joint is compressed for hours against an unyielding surface. The hip joint, particularly the greater trochanter, the bony prominence on the outer hip, bears sustained pressure that compresses the trochanteric bursa. Trochanteric bursitis, inflammation of that hip bursa, is one of the most commonly diagnosed pain conditions in adults over 60. Research published in the Journal of Orthopedic and Sports Physical Therapy found that in a study of adults over 65 with trochanteric bursitis, 71% showed significant reduction in pain symptoms within 30 days of implementing corrective sleep positioning and mattress assessment. 71% without cortisone injections, without surgery, without medication, and the shoulder rotator cuff compression during sleep, particularly sleeping on the affected shoulder, is a significant and under-recognized cause of rotator cuff tendinopathy in adults over 60. The diagnosis is made as rotator cuff pathology. The intervention prescribed is physical therapy and sometimes surgery. The root cause, sleeping directly on the shoulder for 7 hours every night, is never addressed. The specific correction: when side sleeping, the shoulder you are lying on should be positioned slightly forward of your body, not directly beneath your weight. This means allowing the shoulder to roll slightly toward the mattress edge rather than bearing your full torso weight vertically. A pillow supporting the upper arm and positioned between the knees to align the hips reduces pressure point loading at both joints simultaneously. Number 6. Acid reflux that wakes you at night, that causes chronic hoarseness, that is driving you toward medication you may not need, is in most cases a sleep position problem. I made this point in the science section, but I want to go deeper here because the consequences are more serious than most people realize. Nocturnal acid reflux is not merely an uncomfortable inconvenience. When acid reaches the esophagus during sleep, the swallowing reflex that normally clears it is suppressed. Acid sits in contact with the esophageal lining for extended periods. Research from Johns Hopkins found that acid exposure time during sleep is on average 7 times longer than acid exposure during waking hours per reflux event because of this suppressed clearance. 7 times longer contact time. Same acid, different state of consciousness. Chronic nocturnal acid exposure causes progressive esophageal tissue damage. It is the primary driver of Barrett's esophagus, and Barrett's esophagus is the primary precursor to esophageal adenocarcinoma, a cancer whose incidence has increased 600% in the United States since the 1970s, predominantly in adults over 60. Right-side sleeping makes every one of these consequences more likely. Every single night. Left-side sleeping reduces nocturnal acid events by keeping the gastroesophageal junction above the acid pool in the stomach. Studies using esophageal pH monitoring have shown that left-side sleepers experience fewer and shorter acid exposure events than right-side sleepers regardless of meal timing, regardless of medication use, and regardless of body weight. And beyond the esophagus, nocturnal acid aspiration, tiny amounts of acid mist reaching the lungs during sleep, is a recognized cause of chronic cough, sleep-disrupting throat clearing, and worsening of asthma and chronic obstructive pulmonary disease in adults over 60. If you have a chronic cough that your doctor has not been able to fully explain, your sleep position may be the source. Let me tell you about Susan. Susan was 67 years old, a retired elementary school nurse from Boston, Massachusetts. She came to me with a cluster of complaints that had been building for 2 years. Chronic morning hoarseness that her ENT attributed to laryngopharyngeal reflux, a persistent dry cough that her pulmonologist attributed to mild asthma, progressive right shoulder pain that her orthopedist was considering as a rotator cuff issue, and what she described as waking up feeling like she had not slept at all, regardless of how early she went to bed. 4 separate specialists, 4 separate diagnoses, 4 separate treatment plans, and not one of them had asked her how she slept. Susan was a lifelong right-side sleeper. She slept on her right side with her right shoulder compressed directly beneath her, her head on a soft pillow that had compressed over years to about 2 inches of loft, and with no support between her knees. When I explained the mechanism of each of her complaints through her sleep position, Susan was speechless. The hoarseness and cough from nocturnal right-side acid pooling at the gastroesophageal junction, the shoulder pain from 7 hours nightly of direct rotator cuff compression, the morning exhaustion from positional airway narrowing fragmenting her sleep architecture, We changed one thing: her sleep position, and the pillow strategy that made it sustainable. We transitioned her to left side sleeping with a cervical contouring pillow at appropriate height, a body pillow supporting her back to prevent rolling, and a firm pillow between her knees for hip alignment. At 3 weeks, her morning hoarseness was substantially reduced. At 6 weeks, her cough had improved significantly. At 2 months, her shoulder pain had decreased by what she estimated was 70%, and she told me she had forgotten what it felt like to wake up and actually feel rested. Her ENT, her pulmonologist, and her orthopedist all noted improvement at her subsequent follow-up appointments. None of them attributed it to sleep position. This was not a miracle. This was removing structural insults that were happening every single night during the hours when the body was supposed to be healing, and the same intervention is available to every single person watching this video. Number 5. The glymphatic system and Alzheimer's prevention connection is the most important sleep science discovery of the last decade, and most doctors have never discussed it with their patients. I introduced the glymphatic system in the science section, but the implications deserve their own dedicated discussion because this is where sleep position crosses from physical comfort into cognitive destiny. Your glymphatic system operates almost exclusively during slow-wave deep sleep. This is the deepest sleep stage, the restorative sleep stage, the stage that diminishes most significantly with age, and the stage most disrupted by backsleeping and sleep apnea. A research team at the University of Rochester demonstrated that during sleep, the glymphatic system expands the spaces between brain cells by approximately 60%, allowing cerebrospinal fluid to flush through and carry away the waste products of neural metabolism. The primary targets of this cleaning operation are beta-amyloid and tau proteins, the exact compounds that accumulate into the plaques and tangles characteristic of Alzheimer's disease. The critical finding from the Journal of Neuroscience study was that the efficiency of this glymphatic flush was highest in the lateral sleeping position, specifically the left lateral position, and was reduced by up to 25% in the supine position. The anatomical explanation involves the direction of cerebrospinal fluid flow relative to gravity, which is optimized when the brain's drainage angles align with the lateral position. What this means practically is this: every night you spend sleeping predominantly on your back is a night during which your brain is clearing 25% less beta-amyloid than it could. In your 40s, your glymphatic system has enough reserve that this partial inefficiency is compensated. In your 60s, 70s, and beyond, when glymphatic efficiency has already naturally declined, losing an additional 25% of clearance capacity every night is a meaningful acceleration of the amyloid accumulation that precedes and drives Alzheimer's pathology. Research published in the journal Neurology found that markers of glymphatic dysfunction were detectable in adults who had habitually slept fewer than 7 hours or who had chronic backsleeping patterns years before any cognitive symptoms appeared. Years before. The intervention costs nothing. It requires no prescription. It requires no medical procedure. It is your sleep position. Number 4. The knee pillow is not optional. It is structural therapy. When you sleep on your side without a pillow between your knees, your upper knee drops toward the mattress. This drop creates a chain of structural misalignments that travels from the hip through the pelvis and into the lumbar spine. When the upper knee drops, the hip adducts and internally rotates. This rotation strains the sacroiliac joint, the pelvis tilts, and the lumbar spine curves laterally to compensate. This lateral lumbar curve, sustained for 7 hours, applies asymmetric compressive forces to the lumbar discs and facet joints on the lower side. Research published in the Journal of Back and Musculoskeletal Rehabilitation found that side sleepers who used a correctly sized pillow between their knees reduced lateral lumbar deviation by an average of 12 degrees compared to those sleeping without knee support. 12 degrees of spinal deviation, sustained for 7 hours, is clinically equivalent to the spinal loading experienced during moderate physical activity. Your spine should not be doing moderate physical work while you sleep. The correct knee pillow for adults over 60 is a firm foam pillow approximately 6 to 8 inches thick, placed between the knees with the upper knee resting neutrally aligned with the hip and shoulder in a straight vertical line. This single addition to your sleep setup has been shown in multiple studies to reduce morning lower back pain, sacroiliac joint tenderness, and hip bursitis symptoms more effectively than any sleep medication currently available for these complaints. And for adults with diagnosed lumbar disc disease, lumbar stenosis, or sacroiliac joint dysfunction, a knee pillow is not a lifestyle suggestion. It is the single most important nighttime structural intervention available outside of surgical intervention. I need to stop here at the halfway point and ask you to do something right now. If you have been sleeping on your back or your right side for years, and this video is explaining symptoms you have been living with and could not fully account for, please hit the like button right now. It costs you nothing, and it gets this information in front of the people who need it. Type your sleep position in the comments right now. Back, right side, left side, or stomach, and then type the one symptom from this video that most closely matches something you have been experiencing. I am going to read every single one. And please share this video with someone in your life who wakes up every morning saying they slept terribly, because the answer to that problem is probably in this video. And sharing costs you nothing. Now let us finish the countdown with the 3 most critical points on this list. Number 3. Elevating the head of your bed by 4 inches is more effective for nocturnal acid reflux and sleep apnea than any over-the-counter sleep aid, and almost no one does it. This is distinct from using extra pillows under your head, which actually worsens both conditions. Extra head pillows create cervical flexion that narrows the airway and increases GERD by bending the esophagus at an angle that traps acid at the lower esophageal sphincter. What I am describing is elevating the entire head of the bed, the headboard end of the mattress and box spring, raised by 4 to 6 inches so that your entire body is on a gentle incline. This incline does 2 things simultaneously. It uses gravity to keep stomach acid pooled in the fundus of the stomach, away from the gastroesophageal junction during sleep, and it positions the upper airway at a mild angle that reduces the posterior gravitational pull on the soft palate and tongue, decreasing the frequency and severity of positional airway obstruction. Research published in the journal Diseases of the Esophagus found that bedhead elevation of 4 to 6 inches reduced nocturnal acid exposure time by 67% compared to flat sleeping. 67%. Without medication, without a CPAP machine, without dietary changes, 67% reduction from raising the head of the bed by 4 to 6 inches. The practical implementation, purpose-built bed risers, available for under $20 at any home goods store. Place them under the 2 legs at the head of the bed only. The 4-inch elevation is safe for all adults, does not disrupt sleep onset, and does not require mattress replacement. Combined with left-side sleeping and appropriate cervical pillow support, this creates a comprehensive positional sleep protocol that addresses acid reflux, sleep apnea, and glymphatic drainage simultaneously. Number 2. The specific left-side sleep protocol and everything you need to implement it starting tonight. I want to be precise here because generic advice does not produce specific results. The goal is to maintain left lateral sleeping position throughout the night. The challenge for adults over 60 is that neuromuscular habit and positional discomfort cause rolling during sleep. Research shows that adults roll from their initial sleep position on average 4 to 6 times per night. Without structural support, transitioning to left side sleeping results in returning to habitual position within the first 90 minutes for most people. Here is the specific structural solution. First, your primary sleep surface must support the hip to shoulder width without causing the upper body to collapse toward the mattress. For most adults over 60, a medium firm to firm mattress in the range of 5 to 7 on a 10-point firmness scale provides adequate pressure relief at the shoulder and hip without allowing the shoulder to sink and rotate the spine. Second, your cervical pillow should maintain your head and neck in neutral lateral alignment. Measure from the side of your neck to the tip of your shoulder while standing. That measurement is your target pillow loft. For most adults, this is 4 to 6 inches. A memory foam side sleeper pillow specifically designed for lateral cervical support is the most reliable option. Third, Place a firm body pillow or rolled blanket behind your back, running from your upper shoulder to your mid-buttock. This acts as a mechanical stop, preventing rolling to your back during sleep. The position should feel like you have something to lean slightly against, rather than something you are fighting. This simple addition reduces nighttime position rolling by over 60% in research trials. Fourth, place a firm pillow between your knees, not a decorative pillow, not a soft plush pillow. A firm foam or memory foam pillow approximately 6 to 8 inches in diameter. Your upper knee should rest on it in neutral alignment with your hip. Fifth, your lower arm should extend forward and slightly down from your shoulder, not folded beneath your pillow. Folding the lower arm beneath the pillow elevates the shoulder and creates cervical lateral flexion. The arm extended forward distributes the shoulder's weight across the mattress surface rather than concentrating it on the joint. Sixth, begin your transition over 2 to 3 weeks. If you are a lifelong right side or back sleeper, forcing yourself to remain on your left side from night 1 will create discomfort that makes the transition unsustainable. For the first week, start on your left side each night and allow yourself to roll. Simply restart on your left side each time you naturally wake. Week 2, introduce the back support pillow. Week 3, the full protocol. By the end of the 3rd week, most adults have established the lateral positional habit to the degree that it persists through the night. And number 1, the most critical thing to understand about sleep position after 60. It is not a comfort preference. It is a health decision with consequences as significant as diet and exercise. I want to be very clear about what that means. Sleep occupies approximately 1/3 of your entire life. 1/3. If you live to 80, you will have slept for approximately 25 years. The position you are in for those 25 years is not neutral. It is either systematically supporting your brain waste clearance, your cardiac efficiency, your digestive integrity, your lymphatic drainage, your cervical and lumbar alignment, and your airway patency, or it is systematically compromising all of them. We would not accept exercising with chronically poor form for 25 years and be surprised by the injury. We would not accept eating in a way that systematically stressed our organs for 25 years without expecting consequences. But we accept sleeping in damaging positions for 25 years and then attribute the outcomes entirely to aging. A comprehensive review published in the journal Sleep Medicine Reviews analyzed the cumulative health effects of sleep position over a lifespan and concluded that habitual sleep position is an under-recognized modifiable health behavior with quantifiable effects on Alzheimer's disease risk, cardiovascular health, gastrointestinal disease, musculoskeletal integrity, and immune function. Quantifiable effects on Alzheimer's risk from your sleep position. And the most important finding from this review, the effects of corrective sleep positioning were detectable within weeks in conditions like acid reflux and shoulder pain, within months in conditions like sleep apnea severity and lumbar disc pressure measurements, and within years in neurological and cardiovascular markers. Change your position tonight. The benefits begin accumulating from the first night, and the compound interest of correct sleep position, accrued over months and years, is one of the most accessible and completely free health investments available to every adult over 60. I want to tell you about Charles. Charles was 74 years old, a retired civil engineer from Dallas, Texas, a big man, 6 feet 2 inches, who had slept on his back his entire life. He had been diagnosed with moderate obstructive sleep apnea 5 years earlier and had been using a CPAP machine with what he described as partial compliance. He wore it when he remembered it. He did not wear it many nights. He hated it. He came to me because, despite the CPAP machine sitting beside his bed, he was waking up 3 to 4 times per night, had profound daytime fatigue, and his wife had told him that his snoring had actually gotten louder in recent years, not quieter. His cognitive function had also concerned him. He was a man who had spent his career solving complex engineering problems. He noticed that his word retrieval was slower, that following complex conversations required more effort, and that he was making errors in mental arithmetic that he would not have made 10 years earlier. When I took a detailed sleep history, the picture became clear. Charles used his CPAP some nights. On nights he did not use it, he slept on his back and had between 20 and 35 apneic events per hour according to the machine's recorded data when it was worn. On nights he did use the CPAP, he was sleeping on his back still, wearing the machine, but repeatedly pulling the mask off during sleep because the back position increased the seal pressure and made it uncomfortable. We worked on two things simultaneously: left side positional sleep with a backstop pillow and appropriate cervical support, and a different CPAP mask configuration designed specifically for side sleepers. At 6 weeks, Charles's nightly awakening frequency had dropped from 3 to 4 times per night to once or twice. At 3 months, his wife reported that the snoring had substantially decreased. His own sleep tracker data showed consistently longer periods of consolidated deep sleep. He told me at his 3-month appointment that his mind felt clearer than it had in 2 years. He was back to completing the New York Times crossword that he had been struggling to finish. His word retrieval had noticeably improved. I will not tell you that this definitively reversed cognitive decline. I will tell you that it removed a nightly insult to his brain's waste clearance system that had been accelerating whatever cognitive change was occurring. And the removal of that insult produced measurable improvements in his daily function within weeks. This was not a miracle. This was positional medicine applied to a specific structural problem. And the same approach is available to you. And Barbara was 71 years old, a retired high school principal from Phoenix, Arizona. She came to me for what she described as a body that had betrayed her. Every morning she woke with lower back pain that required 45 minutes to work out before she could move normally. Her right hip ached constantly. She had been to a chiropractor twice a week for 3 years. She had tried 3 different mattresses. She had been through 2 rounds of physical therapy for what had been diagnosed as right-sided trochanteric bursitis. She had spent thousands of dollars and 3 years on her back and her hip, and she was no better. When I asked how she slept, Barbara told me she was a right-side sleeper. Always had been. She slept with a soft pillow that had compressed over time to perhaps 1.5 inches of height. No pillow between her knees. Right shoulder compressed beneath her body weight for 7 hours every night. I drew her a diagram on a piece of paper. The shoulder compression on the right rotator cuff. The hip adduction and internal rotation from the unsupported upper knee dropping to the mattress. The lateral lumbar curve produced by the hip rotation, the asymmetric compressive loading on the right lumbar facet joints, the mechanical insult to the right trochanteric bursa from hip adduction. Every symptom she had paid thousands of dollars and 3 years to treat was the direct mechanical consequence of her right side sleep position and her absent knee pillow. We transitioned her to left side, sleeping with a firm knee pillow and appropriate cervical support over a 3-week protocol. At 3 weeks, her morning warm-up time had reduced from 45 minutes to approximately 15 minutes. At 6 weeks, the right hip pain had decreased by what she estimated was 60%. At 3 months, she told me she had canceled her standing chiropractic appointment because she no longer felt she needed it. Her morning lower back pain, which she had accepted as her permanent reality for 3 years, was essentially gone. She told me, 3 years, and no one ever asked me how I slept. This was not a miracle. This was the recognition that the mechanism causing the damage was happening every single night, and that removing the mechanism removed the injury, and that same recognition is available to you. Here is your complete action plan, specific, numbered, starting tonight. Step 1. Assess your current position. Tonight, before you go to bed, ask yourself honestly, what position do I spend most of the night in? Back, right side, left side, or stomach? Be honest. Your neck pain, your acid reflux, your hip pain, your morning fatigue, they have been telling you the answer for years. Step 2. Obtain your positional support items this week. A cervical pillow matched to your shoulder-to-neck measurement. A firm body pillow or large firm bolster for your back support. A firm foam knee pillow 6 to 8 inches thick. These 3 items together cost less than a single chiropractic visit. They are the structural foundation of correct sleep position. Step 3. Elevate the head of your bed by 4 to 6 inches using bed risers under the headboard legs only. Inexpensive, immediate. This alone addresses acid reflux and sleep apnea simultaneously. Step 4. Begin the 3-week transition protocol. Week 1. Start on your left side each night. Allow yourself to roll. Restart on left each time you wake. Week 2. Add the backstop body pillow to mechanically prevent rolling. Week 3. Complete protocol with knee pillow and correct cervical pillow. Do not try to implement everything on the first night. Step 5. If you have been diagnosed with sleep apnea and use a CPAP, speak to your sleep specialist about a side sleeper mask configuration. The two interventions together produce synergistic benefits. Step 6. Reassess your mattress. If your mattress is more than 8 years old, or if you sink more than 3 inches when lying on your side, it is no longer providing adequate spinal support. A medium firm mattress in the 5 to 7 range on a standard firmness scale is optimal for lateral sleeping in adults over 60. Timeline of what to expect. Within 3 to 7 days. Noticeable reduction in morning acid reflux symptoms in right to left side converters. Within 2 to 3 weeks, measurable reduction in shoulder and hip pressure point pain. Within 4 to 6 weeks, improvements in sleep continuity and reduction in nighttime awakenings. Within 2 to 3 months, measurable reduction in morning cervical and lumbar stiffness, improvements in resting blood pressure in some adults, and improvement in daytime cognitive clarity in adults with positional sleep apnea. 5 mistakes I see people make when they try to act on this information. Mistake 1. Using multiple soft pillows stacked under the head thinking elevation is equivalent to bedhead elevation. It is not. Multiple head pillows create cervical flexion that bends the neck forward. This actually worsens airway obstruction. It concentrates weight on the cervical spine rather than distributing it, and it creates esophageal angulation at the lower esophageal sphincter that traps acid rather than preventing reflux. 1 pillow, the right height, not stacked soft pillows. Mistake 2. Switching immediately to left side sleeping without structural support and concluding it does not work within 1 week. The transition requires 3 weeks of gradual implementation with proper support tools. Adults who try to force an abrupt position change without pillow support report increased shoulder and hip discomfort, conclude the position is causing new pain, and revert to their old position. The discomfort in the first week is positioning without support, not left side, sleeping itself. The support changes everything. Mistake 3. Believing a memory foam mattress alone solves the problem. Memory foam that is too soft allows the shoulder and hip to sink beyond neutral spinal alignment. A mattress that is too firm creates excessive pressure at the shoulder and hip, causing pain that forces rolling. The mattress is the foundation. The pillow protocol is the structure built on that foundation. Both are necessary. Mistake 4. Addressing only one symptom rather than the system. If acid reflux is your primary complaint, left side sleeping plus bedhead elevation addresses the system. If shoulder pain is your primary complaint, left side sleeping plus correct pillow height plus forward shoulder positioning addresses the system. If cognitive clarity and sleep quality are your concern, left side sleeping plus back stop pillow plus sleep apnea assessment addresses the system. Each symptom is a manifestation of the same root cause. Address the whole system, not just the most uncomfortable symptom. Mistake 5. Not discussing this with your doctor and missing an opportunity for measurement. The improvements from corrective sleep positioning are measurable. Your blood pressure should be measured before and after 3 months. If you have had esophageal pH monitoring for reflux, a repeat test would document improvement. If you have sleep apnea, your CPAP machine records apnea events and will show improvement with positional change. The data from your own body is the most powerful evidence available. Do not miss the opportunity to document the change you are creating. You are not broken. Your body is not broken. The way you were sleeping was broken. Let me recap all 10 points one final time. Number 10. Stomach sleeping is causing 40% additional cervical disc compression force every single night. The cervical spine is not designed for sustained 90-degree rotation. Number 9. The wrong pillow height is creating 8 to 15 degrees of sustained lateral cervical flexion equivalent on MRI to poor workplace ergonomics held for 6 hours. Measure your shoulder to neck distance. Match your pillow loft to that measurement. Number 8. Positional sleep apnea affects 56% of adults with sleep apnea, and lateral sleeping alone reduces apnea-hypopnea index by 54%. No machine required for the position change itself. Number 7. Trochanteric bursitis. Rotator cuff tendinopathy and lumbar facet pain in adults over 60 are in the majority of cases directly mechanical consequences of sleep position pressure points. 71% showed significant pain reduction from positional correction alone. Number 6. Right-side sleeping creates nocturnal acid exposure that is 7 times longer per event than daytime exposure, driving Barrett's esophagus risk at a rate increased 600% since the 1970s. Number 5. The glymphatic system clears beta amyloid at up to 25% lower efficiency during back sleeping compared to lateral sleeping, compounding Alzheimer's risk across years of habitual supine sleep. Number 4. The knee pillow eliminates 12 degrees of lateral lumbar deviation sustained for 7 hours nightly, addressing lumbar disc compression equivalent to moderate physical activity. Number 3. Elevating the head of the bed by 4 to 6 inches reduces nocturnal acid exposure by 67% and addresses positional airway obstruction simultaneously. Number 2. The complete left side sleep protocol. Cervical pillow, backstop body pillow, knee pillow, forward shoulder positioning, implemented over 3 weeks. And number 1. Sleep position is not a comfort preference. It is a health decision with quantifiable consequences for Alzheimer's risk, cardiovascular health, gastrointestinal disease, musculoskeletal integrity, and immune function. It occupies 1/3 of your life, and it is entirely within your control. Here is my challenge to you. Commit to just 3 changes, not all 6 steps. 3. Starting tonight. Start on your left side tonight. Order a knee pillow this week and raise the head of your bed by 4 inches. Just those 3, starting tonight. Your body has been performing extraordinary maintenance operations every single night of your life. Your brain has been washing itself clean of the proteins that cause Alzheimer's. Your heart has been recovering from the demands of the day. Your digestive system has been completing its work. Your lymphatic system has been draining the inflammatory debris of daily living. Your muscles and joints have been attempting to recover from their daily load. Every one of those operations is more efficient, more complete, and more protective in the correct position. You have been sleeping in the wrong position for decades, not because you were careless, not because you were uninformed, because no one told you that your sleep position was a health decision, because no one told you the biology, because no one connected your morning back pain and your acid reflux and your foggy brain to the angle of your body at 3 in the morning. You are not broken. Your body is not broken. The position you have been sleeping in was broken, and tonight you can sleep differently. Please subscribe to this channel. I release new health information for adults over 60 every single week. Ring the notification bell. Type in the comments what sleep position you currently use and which 3 changes you are committing to starting tonight. Share this video with one person who wakes up every morning feeling like they have not slept. Aging does not take away your body's ability to recover. It simply reminds you to care for it the right way. Take care of yourself.